Hunsaker. I'm going to start by doing the axial compression test. So we're going to lift up their leg like this. We're testing for labral pathology, and a positive test is reproduction of symptoms. So we're going to put the leg in this position and then apply axial compression. Any pain? He says no. Now we're going to do the internal rotation test. So we're going to put their leg in this position and then do internal rotation of the hip like this. We're looking for labrum pathologies or impingement, and a positive test is reproduction of the nerve symptoms. Okay, now we're going to do the hip scour test. We're going to put the leg in the same position. We're going to do an adduction of the hip. We are looking for pain is a positive test here, or reproduction of the nerve symptoms. And we're testing for labral impingement? No, labral something. Pathology. Labral pathology or impingement. We're going to be doing the Kendall test. So this is a test for tight hip flexors. So we're going to have her pull one knee to her chest, just like that. And a positive test is if the other knee extends and lifts off the table. This is the Trendelenburg test. It's testing for a weak gluteus medius. So we're going to have them stand on one leg with their hands on their hips, just like that. And if the non-weight-bearing hip drops, it is a positive test.
Hi, I'm Kirsten Miggs, and we're going to start with doing the piriformis test. So you're going to have her lay on her back, and then you'll take the leg where the tightness is at and have her cross it over her body. And what you're looking for is pain, and then a positive test will indicate tightness of the piriformis. Now I'll do the femoral nerve traction test. For this test, you're going to stabilize their hip, and then you're going to pull it backwards right here. And for a positive test, they'll have femoral nerve pathology. And you're just, with this test, you're just doing their symptoms again. So you're just pulling at the nerve. All right, this is the straight leg raise test. So what you'll do is you'll lift their leg up, and you'll also dorsiflex the foot. In this, you're just doing a reproduction of the symptoms, and they'll have nerve pathology if it's a positive test. Okay, so for the slump test, you're first gonna have them slump down, so just have them go down, like I have that posture, and then you'll compress down onto their spine. And then you'll have them further put their chin towards their chest as far as they can and compress on the spine. You'll have them extend their leg and then compress again on the spine, and then have them dorsiflex their foot and compress again on the spine. And for this, you're just doing a reproduction of symptoms, and if it's a positive test, they have neuropathology. Okay, so for the Koenig-Brodzinski test, you're going to have them, I'm going to lift their leg up, so their knees extended, and then you'll have them lift their head up to here. This is just a reproduction of symptoms. Positive test is neuropathology.
I'm Andrew Richardson, and today I'm going to show you the Valsalva maneuver. It's a test for neuropathology, and a positive test is reproduction of the symptoms that they're experiencing. So to have them perform this test, you're going to have them pretend to blow into their hand, closed fist, to create pressure in the abdominal cavity to test for neuropathology. We're going to do the SI compression test. This is testing for a sacroiliac sprain or dysfunction. To perform the test, you're going to push out on the iliac crest of the patient to compress the SI joint, and if they experience pain, that's a positive test. Now we're going to do the SI distraction test. This is also a test for SI sprain or dysfunction. To perform the test, you're going to squeeze the iliac crest to distract the sacroiliac joint, and pain would be a positive test. Now we're going to do the Stork standing test, which is a test for spondylolysis. To perform the test, you're going to have the patient lift one leg with their hands on their hips and then extend at the back, stand behind them to make sure they don't fall. And you're looking for a reproduction of symptoms, which would be a positive test. All right, now we're going to be performing this SI dysfunction screening. To start, you're going to have them lay on their back and relax their legs and look at the level of the medial malleoli to see if there's any change in level. This looks pretty even. And then you're gonna have the patient stand up, and we're gonna look at the levels of the iliac crest. So you come down, find it. They should be level. And then you're also going to look at the angle of the ASIS and the PSIS to look for anterior or posterior tilt. So you find both of those landmarks, and then look, this looks pretty level. And then at the end, you're going to have the patient sit on the table, and you're going to find the PSIS again, and then you're going to have them lift a leg, and then lift the other leg, and you're looking for downward rotation, and then you're going to have them lean forward, and this should be upward rotation. The SI dysfunction screen is to test for SI dysfunction in the sacroiliac joint.
Hey, I'm Kyler Norris. Today we're going to be doing the Hoover test. So this is a positive test if there's a lack of pressure under the opposite leg. But to explain it first, so we're going to have our patient lie down with her legs fully extended. And then I'm going to put my hands just under her ankles and heels here. And then whichever leg she's complaining about to be injured, I'm going to ask her to raise it. So I'm going to ask her to raise this right one. And if she can't raise it and I feel pressure under here, then it's a negative test. But if there's a lack of pressure, then it's a positive test. And that pathology is malingering or just faking it. All right, we're going to do the lateral rib compression test. Here we're looking for the pathology is a fracture, and we're looking for pain or crepitus. So I'm going to stand behind her and then just slightly press on her ribs. Here, compress them together, and if there's pain, then that's a positive test. All right, we're going to be doing the anterior-posterior rib compression test. We are also looking for pain and crepitus on this test, and the pathology is also a rib fracture. So I'm just going to get to her side right here and compress right there, and the ribs down here. And if there's pain or crepitus, it's a positive test. We're going to be doing the cervical compression test. What we're looking for is a reproduction of symptoms here, and the pathology is a nerve root pathology. So what I'm going to do is I'm just going to press down on her head here. And like I said, if there's that reproduction of symptoms, then it's a positive test. So we're going to be doing the shoulder depression test. The pathology for this test is a brachial plexus traction injury. And what we're looking for here is a reproduction of symptoms. So what I'm going to be doing is just depressing the shoulder here and moving the neck over. And then I'm going to come and do the other side real quick, depress the shoulder and tilt the head. And if there's a reproduction of symptoms, it's a positive test. All right, we're going to be doing the Adson's test. The pathology for this test is a brachial plexus compression. And what we're looking for is a diminished pulse or numbness. So how we're going to do this is we're going to have her extend her arm. I'm going to find her pulse here. And then as we move her arm back, if that pulse diminishes, then it's a positive test. Or she's going to look at me, tilt her head this way, and then if she tilts it away and the pulse diminishes, then that's also a positive test.